We've learned so much in 2025 from all of the wonderful guests that have come on the podcast. So today I'm going to share some of the top things that I have learned from them that have changed my life and helped to change my overall health and wellness in 2025. Welcome back to Wellness Fixes the Pod. I'm your host, Dr. Kelsy Vick, a board-certified orthopedic doctor of physical therapy and a pelvic floor physical therapist. And I know there is a lot of women's health information out there and just different things that different so-called experts like to say about the female body. So I really pride myself on this podcast specifically getting on the highest quality experts. And we have had so many amazing guests on the podcast this year, but I wanted to share some different clips from throughout the year of what these experts have told us and educated us on that has actually changed my own routine, whether it be my exercise routine, my fueling routine, my supplementation routine, or different things that I've learned from those guest experts that I am constantly sharing with my friends and patients. I thought it would be a fun episode to really just pull out some of the I call them little knowledge bombs. I don't even know if they're going to allow me to say the word bomb, but knowledge bombs that these experts have shared with us. One of the things I learned the most about this year in 2025 was creatine, especially creatine's role in our bodies as women throughout different stages of life, from just our regular menstrual cycle and different ways that creatine can help during different phases of our menstrual cycle, especially when it comes to PMS, to creatine's role during the perinatal period, especially how it can help us during the conception phase, the pregnancy phase, having a healthy birth, and then the postpartum phase. Dr. Stacey Ellery, one of the top researchers in the field of women's health and creatine, breaks down how creatine actually works within our bodies and its role in helping provide enough energy to our cells.
Creatine, the take-home message is that it's involved in energy production within our cells. So it's an amino acid derivative. We find it in meat-based animal products, but our body also synthesizes it. And it's kind of like a little magnet for something called phosphates. So phosphates are the energy currency within our cells. Everyone may have heard of adenosine triphosphate or ATP. That's the go-to energy molecule for all of our cells. We need ATP to keep the cells functioning. And creatine plays a critical role in storing the phosphates in our cells that are needed to make that ATP. And so when creatine enters into our cells, either being transported in from our blood system or some cells make it, it holds on to a little phosphate and it just holds it tight and lets the cell continue to make energy through its immediate pathway, which is that oxygen and glucose metabolizing oxidative pathway that we all know about. But then when there are shifts in energy demand, that creatine can release that phosphate and it can be used to make ATP really quickly. And that's its important role within the cell. And that's why we start to hear some really, maybe even conflicting information about creatine. We know it's important for skeletal muscle and exercise performance. And now there's a lot of chatter about the brain. And then I'm going to sit here today and tell you that it's really important for the uterus and the ovary and the placenta and the baby. And the skeptics out there might be thinking like, hang on a second, this can't be some sort of wonder nutritional treatment that is going to tackle all of these things. And I appreciate that skepticism, but if we remember that it's about energy, energy is critical across all of our cells. That is why creatine can potentially have a role and a benefit for multiple different tissues. It's all about quick energy turnover. And the other thing about creatine in the context of energy, which is really important to understand, is it's the only pathway that is easily manipulated. So if we have more creatine and we can get more creatine into the cell, we can store more of those phosphates, but we can't necessarily store more ATP or store more other energy molecules within the cell. So that's why it's really important too, because we can make it go up and make it go down through some pretty simple mechanisms.
Dr. Stacy's research primarily focuses on creatine's role during the perinatal period, and we talked a lot about how creatine can potentially help during conception, pregnancy, birth, and postpartum. I'll leave the full episode below, but here's one of my favorite clips from the episode that I have shared with a lot of my friends and patients who are going through this phase of life.
Yeah, so it all comes down to cells needing enough energy to conduct their processes. And so for skeletal muscle, obviously the processes that are really important are those contractile functions. And there's a lot of creatine in skeletal muscle cell because they have that high energy capacity and the need to do that. For our reproductive tissues, the easier way to think about it is the regeneration. So if we think about the female reproductive cycle, we have follicles developing every month and eventually releasing a mature oocyte. We have our functional layer of the uterus growing and then shedding away with the menstrual cycle. And all of those processes are super high energy demanding. And so that is where creatine comes into it. So we've been able to show, and others have shown, that cells that just have a high energy capacity because they're constantly turning over do actually use creatine to help balance that energy requirement. So it's a little bit of a shift in the thinking from what we traditionally consider the role of creatine, where energy burst and contractile function. It's more about tissue regeneration and building and the energy required to conduct those processes. You think about it, in a pregnancy, you're growing a whole new little human being, you're growing a whole new incredible organ simultaneously, which is supporting the development of that new little person and conducting all of the major organ systems, that being the placenta. And so the sheer amount of tissue development and generation that's occurring through that process in what is relatively a short period of time, in that 40 weeks, high energy demands, and cells really require to tap into all of their energy producing systems, including creatine metabolism.
Another important creatine fact I learned this year was in our episode with Dr. Katie Hirsch, who is an expert researcher in female physiology, nutrition, training, and performance. She mentions how creatine can be used during different phases of our menstrual cycle to help with various symptoms and limitations we might feel, especially in our luteal phases.
So before I dive in, there are some really great reviews on creatine. Any situation you can think of, there's been some really great review papers that have come out. Some key ones to maybe look up, and I can share these with you later to maybe link people to, but there's a couple myths and misconceptions papers that specifically pulls out these most common myths that people often hear or have questions about. And that was put out by the International Society of Sport Nutrition, written by a whole group of researchers who are key experts on this. So that one's a good one for some specific myth busting and questions of what's actually going on with that. And there's another really good one that specifically focuses on creatine for women's health, written by Abby Smith-Ryan. And so it also goes into good information about female-specific benefits or uses for creatine. So first off, creatine is probably one of the most studied supplements. Caffeine's up there pretty good as well, but lots and lots of data. And we're just seeing more all the time and the benefits it can have across the body. As far as negative effects of creatine, if you're dosing it appropriately, as of right now, there's really not that many downsides to taking it. So by doing some really standard dosing, which typical recommendations about 5 grams per day, you can do a loading dose, but if you take 5 grams per day every day, you'll saturate your muscle stores. And so creatine itself is an amino acid. It's found naturally in meats, and it's stored in muscle. And so you don't get this if you're not consuming meat of some sort. It's not found in plants. It's a muscle specific amino acid. So vegans, vegetarians often have low amounts of creatine in their body because they're not getting it in their diet. But creatine in the body is one of our immediate fuel sources. So if I were to immediately jump out of my chair and need to run out of the room, I would be using creatine to help do that. It's a really rapid way to resynthesize ATP in our body. Anytime we do anything fast, quick, explosive, less than 3 seconds, that uses your ATP creatine system. And so, like you said, started with gym bros. They noticed it was helping them increase muscle mass, get good gains. And the reason for that is when we have more creatine in our muscle, it helps with that energy process. And ultimately, it'll help me with, can I get a few more reps when I'm trying to do like a reps to fatigue? Or does it help me lift just a little bit more? And so ultimately, it's helping you get more out of the workout. And so that's why it's really beneficial, especially for strength, muscle gain, power generation. Sprinters would really benefit from creatine. Those big explosive movements rely on that. So that's kind of where its main benefit started. We're starting to see, by taking creatine, again, through that muscle benefit piece, it's helping minimize loss of muscle as we continue to get older. So that's really helpful. We're seeing benefits to bone. So that's a big deal for women, especially as we're aging. In general, I simplify things and say if it helps the muscle, it's going to help the bone. Muscles pull on bones. So that's really helpful. But it's helping again through, if I can lift a little bit more, if I can get a little more muscle growth, that all helps pull on the bones and keep them healthy. But there is some data that it might be helping with some of the actual bone activation pieces. For women specifically, so women tend to have lower creatine stores compared to men. And so really, we can't get enough creatine in our diet by itself. You'd have to eat an amount of protein and meat that just is unreasonable for a human being to consume naturally. And so much more efficient to supplement and much more efficient for loading the muscle. And so supplementing for women really helps make sure we're going to saturate the muscle and get what we need. There's some really interesting brain benefits. I think this is a really cool area of research for creatine. And we don't have good dosing for the brain benefits yet, but it seems in women especially, creatine can help offset or reduce symptoms of depression. So if you're someone that maybe experiences depressive type episodes or moods throughout menstrual cycle, that could be kind of helpful. If you're someone who maybe chronically experiences some of that, there seems to be some interesting data that more creatine helps offset or reduce some of that with and without medication. So that's a really neat, interesting area. Some of the work I collaborated with coming out of Abby Smith Ryan's lab was, what if we loaded creatine? So you can do a loading dose, which is we get in 20 grams per day, split into 4 doses throughout the day. We do that for 5 days to really quickly saturate the muscle. And so they wanted to look at, if we did a loading dose, either during the follicular phase or the luteal phase, does that have any benefits? So some big things that happen in that high hormone luteal phase, when estrogen's high and progesterone's high, sometimes we see women struggling to do those explosive movements. They just don't feel like they can really max it out, peak, do repetitive high intensity stuff. It just, you feel maybe slightly sluggish. So they were targeting that. Another thing women complain about is sometimes you get maybe bloated and you're holding water and you feel kind of soft during that type of phase. That can be going on. And so, so they were looking at, first and foremost, targeting that power deficit. And their data would show that by loading creatine during that high hormone luteal phase, it did offset power deficits that happened during that time. So that was a key thing. They did then a secondary analysis to kind of look at that water piece. Not only do women maybe feel puffy during that time, but a fear of creatine is I'm going to gain weight. Um, so what they looked at was, do you gain weight? And what's actually happening with that water piece? And so what they were able to show is actually creatine pulls water into the muscle. And so when it does that, to store it in the muscle, it needs water. And so it pulls that water with it. So actually, it helped improve the distribution of water. And so if you're someone that maybe feels puffy, bloated, like you're holding water in your extracellular space, it helps pull it into the muscle where it actually has better benefits and is more useful. And then you can help reduce some of that symptomology that's happening. How much weight do you gain with that? It's not anything drastic. Some people may hold a little bit more than others, but it's coming from water and it's moving that distribution of water better throughout your body. So it's not like you're gaining body fat, which it would be the bigger concern with a weight gain. And so those are some key things. And so I mean, if there's, you could go on and on and on of some benefits, but those are some key ones that we focused on more recently.
These are both episodes and experts that have helped change how I approach creatine in 2025. I have started creatine loading in my luteal phase. I did as soon as I heard Dr. Katie tell me that it could possibly help with some of my exercise and workouts, and then also how just like puffy I feel overall. And I share Dr. Stacy's episode a lot with a lot of my friends who are in that perinatal phase so that they can be a little bit more aware on the current research of creatine during this pregnancy, postpartum, birth, like very confusing phase in a woman's life. Dr. Katie shares how our female physiology differs from men when it comes to fasting, especially fasted workouts. So she talks a lot in the episode about what to do for fueling to help our bodies out, both pre-workout and post-workout, so that our bodies don't sense this low energy availability and start using resources that we don't necessarily want to use as resources for fuel, like our skeletal muscle. I bring up this episode a lot with my friends because I feel like right now fasting is a very hot topic, whether people are pro-fasting or anti-fasting, but I think it's important to separate the knowledge that we have on fasting in general between both the female physiology and the male physiology, because as Dr. Katie explains in this next clip, both handle fasting differently.
So, especially in females, there's a lot of reasons we might exercise fasted, but I think there's kind of that prevailing idea that if I'm trying to lose weight or change my body comp, if I eat less calories and exercise more, that should work the equation. And at a high level, that does. But a lot of the work I did there and continue to think about now is really that's just not totally true for women. And especially in the world where we're talking about like energy availability and how so many females are at risk for low energy availability and red S and kind of those situations, that trickles to fueling around your exercise. And so a lot of the data research we've seen is really eating something before you work out and going into that workout well fueled has so many important benefits, especially for women. The data we've seen doing exercise fasted for women specifically just doesn't result in quite the same effects as if we do it fueled. So a few examples, we did some studies comparing if I consume carbohydrate or protein before either a high intensity workout, a resistance training type workout, aerobic type workout, didn't matter what workout you were doing, getting some fuel in before the workout ultimately helped improve your energy expenditure after the workout and your utilization of fat after the workout. All of that was improved if you consumed some protein before your workout compared to the carbs. So protein before the workout helped improve how many calories you burn and fat use after the workout. The other thing, and we've shown that in a few different studies, getting some protein in before compared to after, before seems to be, again, metabolically more advantageous when we're, again, trying to enhance that post-exercise window. Can we keep burning some calories after the workout and really promote some fat utilization? So then in addition to that, when we go into the exercise more fueled, we can also do better in that workout. So if I feel better going into it and I have the fuel to actually do the workout well, potentially at a higher intensity or get a few more reps out of it, then you're helping the whole situation in general. Your training feels better. You feel like you handled it better. So you're excited to do it again next time. So there's a dual piece of we get more out of the workout, which can help my muscle and body comp. It's helping after the workout. And then I just generally feel better. And it's not such a chore to get to the gym because I don't feel good while I do it. So lots and lots of good benefits. So I encourage all women. It doesn't need to be like a full meal per se. But if you can get some kind of carb protein type snack 30 to 60 minutes before, depending on kind of what your gut can handle, that is a really great way to go. And then soon after, we just want to get some recovery started. And then I always say, as soon as you can get home and have a full meal of some sorts, that's perfect. Men's bodies just seem to handle kind of fasted scenarios a little bit better, maybe is and so if we think about female bodies are just so sensitive to energy levels and those carbohydrate levels. And I like to think about it taking it from a survival perspective. If we just survive, reproduce, that's usually the goal of most organisms. As females, we're doing the reproducing. And so we not only need to like keep ourselves alive and be very resilient, but also keep a second human individual alive and be very resilient for that. So our bodies are very good at holding on to the energy that we have and being very quick to adjust when we're in a situation when maybe there's not enough energy. And so that's super great in that situation. But then put us in today's world. And if we're chronically not getting enough energy, our bodies respond to that and we'll start to do things to conserve. That's a stressful situation. And so it'll do a lot of things to try to hold on to what it has and protect that. And so there's research out there that shows, long term, not good for females. We kick into those mechanisms a lot faster. They happen in men as well, but their threshold for when that type of stuff starts to happen, for example, like red S, that happens in males and females, but the threshold of when we start to see those symptoms and the less positive pieces of that show up happens sooner in females when they're in that deficit, usually compared to males. They can go a little bit longer and go into a little bit deeper hole before the issues start to show up. And so, we're just way more sensitive to that. And so by making sure we are fueling our bodies, and especially when we put it into a eustress situation, exercise is a good stress, right? But it is a stress and we're still taxing the body. And so we want to make sure we're supporting that.
When it comes to fueling for our bodies as women, Mel Sullivan, registered dietitian and another expert in the field of female fueling, training, and performance, gave us a wonderful, simple way to make sure we are fueling appropriately and with the right micro and macronutrients without having to be so obsessive about it.
So I think the bigger piece is let's talk about like the hierarchy of needs for your body. Being in a state of energy availability is the most important, right? So making sure you're eating enough to support your body's baseline, in addition to all of the things that you're asking for it, right? And that calorie level, that macronutrient context is going to be different for everybody. The recommendation I like to give is making sure you're having something every 3 to 4 hours. Like you should be, like physiologically, you should be hungry if you haven't eaten for 3 or 4 hours, especially if we're talking a meal that does include some sort of protein, some sort of like starchier carbohydrate, rice, potatoes, pasta, plantain, something along this line. And then you get into like veggie and fat kind of like sprinkles on top of it, right? So the structure of that plate, we can talk about it in terms of performance plates. I really like, for most people, especially my active, the population I work with is as expressed, like either identifies as a female athlete or is an active individual who's training 3, 4, 5 days a week, maybe working towards specific types of events, sporting events, endurance events, whatever that might be. So breaking up your plate into thirds is a good place to start. I feel like it's important to talk about the plate because protein is having a moment, which is great. Love protein, but like if we're having so much protein or we're so focused on protein that we are now not eating carbohydrates, especially starchy carbohydrates. So one of the concerns that I have to see, it's probably easier to speak to that too, is, an obsession or fixation on clean eating or whole foods, getting a majority of carbohydrates from fruits and vegetables. And fruits and vegetables are great. Fiber is great. Too much fiber does not help you. It doesn't help your hormones. You actually need to have a certain amount of starchier carbohydrates. Again, easy to digest carbohydrates, easy energy that is readily available for our body. Otherwise, you might start to see changes in your menstrual cycle. You might start to see changes in your bone density, which is not something that we want to compromise at this time, because by the time we turn 20, our bone density is established, essentially. So just even backtracking a little bit to adolescence, between the ages of 13 and 18, by 18, you've accrued 90% of your bone mineral density. So after that, we're just hanging on, right? Like we can buffer, we can build minimally. I have worked with women in menopause, particularly like within 60 and 70, who have been able to put on a small bit of bone density. Like it is possible. It's not easy, and it requires like very specific regimens to do that. So we don't want to be playing catch up. By the time we get to our 20s and 30s, we want to have accrued as much as possible. So, and like set ourselves up for success physically there. So, really making sure that you're eating those 3 base meals. And that's a good way to think about setting up your plate. And then where snacking comes into play is, I would say most people, in especially like more traditional work environments, might have breakfast somewhere between 8 and 9, lunch between noon and 2, and then there's this huge window until dinner. So a lot of people I end up seeing might go 6, 7, 8 hours before they eat dinner. We either need to get in another meal. There's enough room to get another meal if your work life allows for that, or your day to day, right? So depending on the job you work, you're probably not gonna be able to sit down and have another meal. But what we can do is plan to have some robust snacks to bridge the gap between that lunch and dinner. So you think of a meal as something that would physically satisfy your body for 3 to 4 hours. A snack is something that would physically satisfy you for 1 to 2 hours. So it helps to bridge that gap. If you think about a plate, and you break it up, you break your plate up into 3 like pretty even pieces. You want some of that to be protein, right? So if you are an animal protein consumer, it could be eggs or chicken or fish or red meat of any sort of kind. If you're more of like a veggie forward eater, that would be beans and tofu, or another form of, tempeh, another form of soy that would kind of like cross with your starch, your carbohydrate side, right? So rices, pastas, potatoes, things like that. And then your other third would be your veggie. So that would be like your fruit, veggie, color. Just think like the colorful part of your plate. So a lot of times what I end up seeing, especially in female populations, is I need to be having half a plate of vegetables or half a plate of like color, right? So everybody is very focused on getting in that color and that fiber. And the thing that gets missed is the essential, carbohydrates. So especially the starchier ones. So a lot of people are wondering why they struggle with low energy availability. That's a lot of what I end up seeing. Or again, just working through the body dysmorphia, struggling relationships to food. And we need to work to normalize taking in carbohydrates that are starchier in nature. And again, just like more readily available for the body. And then you just start to notice you feel better, you feel fuller longer, your meals are much more satisfying. So the fat, like think of your fat as sprinkles, cheese, dressing, olive oil, avocado, nuts, seeds, like that would be like your dressing. So think about that as your sprinkles. When I'm working with someone who's in a season of like training for something specific, so I'll use building towards a marathon for example, that plate shifts. So you are eating more, but like the volume of food is just going to change. So now we're doing more like half of that plate is the starchier carbohydrates. Then you prioritize protein, and then the veggies really become the sprinkles. Like we need different nutrients depending on what we are asking of our body. And that I find is it's hard for people to recognize because they feel like, how could I do this? Or I'm going to gain weight, or my body's going to change, or this isn't what I need, or this person says I need to just be eating protein and veggies, right? Like I don't need to have this, but that's when we start to have issues. So you do. So even getting into, would love your thoughts on this, just given what you do, is the movement side, right? So when I have people who are constantly training, again, marathoning as an example, like the conversations I have with them and their team, because I'm always working in a team with PT and a team with a strength coach and a team with a run coach, whoever the people are, it's what are you racing? So like, let's talk about what you're racing or you're really planning to compete in. And then let's talk about the events that you're participating in purely because you love to compete. Because if we're building towards a very specific rate, like you're planning to push that, then we have to eat differently than in a down season, right? Or like, if you have 3 or 4 months between races, then that's when I'm going to focus more on more veggies, more fruit. Like we're really antioxidants. We're going to really like nourish your body with these types of nutrients, because when you're in the middle of a build, it's about making sure you have enough energy. So the fiber and the color is not as important as making sure you have enough energy. And that's a hard thing to shift when culturally, again, I think in particular, the aesthetic is very tied to performance.
I also asked Mel her thoughts on supplementation and how we should be approaching supplementation as women based on what she sees clinically that most women are either needing more of, getting too much of. And as she says in the episode, it's very individualized, but from a general broad perspective, she does give us some very handy tips when it comes to supplementation as women.
Nail your baseline diet first. Otherwise, you're just wasting money. So like, I have to say that. If you like really kind of nailed your rhythm and fueling, then creatine for sure would be a top. Just a teaspoon, kind of like one serving, 5 grams a day is like a great standard. Probably benefit from more than that, but that would be like individual discussions. I would say start with a 5 gram is the best studied supplement we have. It also we continue to see more and more specific to female physiology outside of just performance, why it is worth taking. I think vitamin D is also a valuable take. Somewhere between 1,000 and 2,000 IUs a day is more than appropriate as like a baseline recommendation. And then what I would say is, I know we'll talk later, and in another following about conception, but if you are in your 20s and 30s and you're thinking about getting pregnant within a year or two, start taking a prenatal vitamin at least a year out. It's like a safety net. So it's not going to hurt you to do that. And then from there, you can get a little bit more nitpicky and specific. But those would be the big ones. Nutrients of emphasis for female athletes as a whole are always going to be iron, vitamin D, calcium. Calcium, I'm cautious about supplementing with the exception of certain populations because of cardiovascular risk. Probably not necessary. It's also easy to get calcium in your diet. If you are vegan and you do not consume any dairy, or you are lactose intolerant, and if you do not consume any dairy, be conscious of like your leafy green intake, broccoli. You could also look at, if you like fish, that wouldn't speak to vegan, but someone who is maybe lactose intolerant, doesn't consume dairy, like fish on a bone, or like fish like tinned fish that typically has some bones that you're not going to taste them, but they're part of it. Like incredible sources of calcium there. Iron is pretty much a one-off single recommendation because the side effect of constipation is pretty uncomfortable. So if you do end up taking it because you have low iron, again, not going to give a specific dose on that because that's person to person specific, but start with every other day. That can help mitigate it. Iron is also, again, especially if you're someone who does consume animal-based protein, red meat's a fantastic source. If you can occasionally get in some sort of organ meat, liver, kidney, heart, there are some great blends now, like ground meat blends that include that as part of it. I used to have clients have to like chop it up and put it in. Now we don't have to do that anymore. It's amazing. But things like that, we can definitely get those nutrients through food, but those are the ones that we're kind of at more of a risk for. So just being thoughtful about it. And vitamin D is not easy to get through your diet, and we are definitely not getting enough from the sun. So sometimes you'll hear like, take it in the winter and don't take it in the summer. And I'm like, no, have seen enough people with low vitamin D throughout the year, unless you live very close to the equator.
One of the coolest things I've learned this year from our guest expert, internationally board certified lactation consultant, Sunaina, was how our bodies as women are prepped and primed for breastfeeding. She mentions how breastfeeding starts out hormonally driven and then turns baby driven. And that is something new that I learned in her episode. You guys can probably hear the shock in my voice when you listen to the episode, but I will leave that clip next because it is one of those fun facts that I like to share with a lot of my patients and a lot of my other friends who are in their breastfeeding journeys.
So I'm going to get a little sciencey and geeky on you. So for the first couple of weeks of your baby's life, your milk supply is all hormonally driven. It's all endocrine driven. Prolactin, which is the milk making hormone, that is sky high after baby has been born and the placenta has been delivered. And then estrogen and progesterone are pretty suppressed by prolactin. Prolactin and estrogen work in opposition. So when one is high, the other is low. However, as your milk volume continues to regulate throughout your breastfeeding journey, it's one of those things where it's important to know that at some point your milk supply goes from endocrine driven to baby driven. So it's really important to make sure that even in the early days, you're hitting 8 feedings or 8 breast stimulations per day. You're making sure that you're letting a baby kind of drain one side fully before moving them on to the other. You're making sure that if your baby gets a bottle for whatever reason, you're pumping in place to create that demand. And I would say at around the 4 to 6 week mark, it really flips from endocrine driven to demand and supply driven, where if you are creating those effective stimulations throughout the day, your body should continue to produce milk at the same rate.
I just think it's so cool that our bodies know what to do and are in control even before breastfeeding becomes more baby driven. As a pelvic floor PT, one of my favorite episodes this year was with my good friend, Dr. Emily Tran. We talked through girly topics that are hard to approach. Things like sex, pain with sex, what happens to our pelvic floors during pregnancy and postpartum, and so much more. She made some very good points about the general function of our pelvic floors, especially during breath work, that I think every man and woman should hear and understand. So I included this next clip in the episode for that reason, because I think it's something we all need to learn about and understand about our bodies and our pelvic floors as we end 2025.
So in regards to sex, let's just honestly bring it back to what is a normal pelvic floor. What should that look like? And if you're booty clenching, we should talk. What I tell people is your diaphragm or your breathing muscle, it sits right under where that rib cage area is, right? Like for the girlies, the girly pops or whoever, right? That sports bra line is kind of right around where it sits. We want to be able to breathe 360 degrees around it, right? And if you don't, we might not be getting full lengthening and excursion of the pelvic floor, because these guys kind of work in tune together. They work very dependently of each other. So if we're breathing well and our diaphragm that sits here, the pelvic floor is going to lengthen and drop down. I kind of imagine it like either a trampoline, or for me, I kind of imagine it like a jellyfish. I tell people
I
like,
love
it's kind of like a jellyfish.
I haven't heard this.
Yes.
Okay.
And I think about that, and it has really helped people. Other ways is like, okay, when I'm able to get a full inhale, I can feel like pelvic floor is like a flower blooming in slow motion. That's another thing that I tell people, some of my clients that I work with. But in terms of that, right, if you have a pelvis, then you have this. Then you should have that healthy relationship, right? In terms of sex health with the pelvic floor, we shouldn't be having like pain with sex. Doesn't matter about any of the sizes of all the things. It shouldn't hurt. For me, that's the first part. We should also be able to achieve climax or an orgasm. That shouldn't be uncomfortable and it shouldn't be painful. Another thing is like, are we able to like feel comfortable during sex, after sex? Some people tell me, okay, well, sex isn't painful, but it's after. I feel really sore after, it's painful after, and I'm just aching.
Yeah.
Those are things that like, for me, that is not normal, right? Normal is I'm able to have an orgasm comfortably. I'm able to be in different positions without pain. There's no like tenderness or discomfort at initial insertion or deep. Those are like the big components of what I think of a healthy pelvic floor with sex health.
We also, of course, chatted about what someone can do if they experience pain with sex or soreness with sex, or have difficulty with penetration or tampon insertion.
It doesn't matter if you have a female or male anatomy. It's just everyone has a pelvic floor that has the same type of functions that play with sex health, sphincteric, like bladder bowel movements, and then just overall stability for the rest of your body above. So a lot of it for me in the beginning is like breath work. And like you said, the reason to see a pelvic floor therapist for pain with sex, right? Because it's not normal, no matter how common it is. Common and normal are not the same, right? We know that a lot of people struggle with dyspareunia or pain with sex. But I'm like, look, there's no TMI. We want to get an orgasm.
Lastly, I wanted to end on a clip that we all should pay attention to as we think about different health and wellness goals that we have for the new year. This clip comes from our episode with Mel Sulliver, a registered dietitian and expert when it comes to female fueling and performance during all life stages. She brings up some wonderful mindfulness exercises and journal topics to think about as we prepare to healthily enter 2026.
But I think a lot of it is language. How are we talking about bodies? Why are we talking about bodies? Like, all bodies are good bodies. Healthy. I'm always very thoughtful. Like, healthy is something that looks different on everybody. There is not a look to health, period. Like, truly like big end of discussion. Bodies are comfortable at different weight, shapes, and sizes. How we define health for ourselves, that's a big exercise I do with all of my clients, especially when this is part of the conversation. Like, how do you define healthy? Like, what would healthy feel like in your body? Not what it look like, what would it feel like? Or what is your body capable of doing when you are healthy, right? So we're taking away healthy, it looks like this. I look like this. And to be clear, I'm all for like a good aesthetic shift, shred, recomp. Love to see what bodies are capable of, but not at the expense of your mental health. And not if you think about your value system as a series of buckets, that's another way to explore it, is where are the different places you put value, right? So from 0 to 100, if you could label that, where would things be? And if a majority of your value is based on how you look, we need to address that, because I don't care who you are, your body's going to change. At some point in time, your body is going to change.
I learned so much from all of our guest experts that we had on Wellness Fixes the Pod this year. But these were some of the top moments that I feel like came up again and again in conversation, but then also influenced how I approached my own exercise routine, fueling, supplementation, those sorts of things in the year 2025. I hope you guys learned a lot from all of our experts. I try to find people that you can trust, because I know that it's very, very hard to decipher who to take education and information from. So just know that all of the experts that come onto the podcast aren't the ones that are the most popular necessarily, but are the ones doing either the clinical work and working with women and patients to help their health and wellness, or are actually researching and are at the forefront of looking into what might be coming next and what's new when it comes to the female brain, body, and physiology. So I love learning from all of them. I feel so honored to be able to interview them and then share their expertise and education with all of you guys. So please let me know if there's any topics or experts that you think I should have on the podcast. I already have so many fun ones lined up for the beginning of the year, and I'm very, very excited to be able to share their expertise, their knowledge with all of you guys. I'm excited to interview them. I feel on cloud nine after all of these guest interviews, because it is just so cool being able to learn from such amazing women and people in the health and wellness space. So I hope you guys had a Merry Christmas, Happy Holidays, and I hope you guys have a Happy New Year coming up this week. I hope you enjoyed this episode. I hope you guys learned a lot from all of the experts we've had on, and I'm excited for 2026. I'm excited to share all of our new interviews and episodes with you guys in the new year, so that when it comes to December 2026, we can do another one of these episodes with even more things that we've all learned from some of the top experts in the field. So I hope you guys enjoyed this episode. I'll see you guys in 2026 and on the next episode of Wellness Fixes the Pod.